Hey, it's Dr. Fox. I want to talk about something that a lot of folks write me about and ask me different questions about their therapeutic process. And that's totally great. I certainly respect and appreciate that. But a lot of times they'll ask me questions because they can't tell their therapist. They're like secrets from their therapist. And I think first and foremost, what we have to do is we have to recognize that therapy is an open environment. Hopefully you feel safe with that person. Your therapist shouldn't be judging you. Your therapist shouldn't be referring to you by disorders or issues that you have. So because what happens is that individuals are people with borderline personality disorder, narcissistic personality disorder, depression, anxiety, PTSD, complex PTSD, psychosis, whatever it may be. And if you feel that there's that barrier where you're afraid to tell him or her, afraid to tell your therapist what is going on, you got to look at that environment. You got to say, okay, what is it that's keeping me from that? And a lot of times what happens is that there are clients of mine that I've had for years. And sometimes they're like, well, I didn't want to tell you because I was afraid you'd kick me out of therapy. I didn't want to tell you because I didn't want you to be disappointed. But what that does is it feeds that negativity. It feeds that fear, doubt, shame, guilt, and that sense of inferiority or that sense of fear of abandonment, fear of rejection, and that sense of emptiness that a lot of individuals hold inside themselves. And if you can shine light on it in your sessions with your therapist, that helps you deal with it and not be afraid of it, about confronting it. And I think it's okay to kind of preface it a little bit. If you want to say, I was a little afraid to tell you that I've been going through this or I haven't told you that, and then talk about it and process it. Because I think that if you hold back, if you hold on to those secrets, what happens is that barrier feeds the mental illness. It feeds the disparity and all of those negative symptoms and issues that we talked about. You've got to be open. And what happens a lot is just another story for you is that folks will contact me and then they'll want to do a consultation with me. And in that consultation, really what they want is they want suggestions about how to deal with the therapeutic issue that they feel they can't deal with their therapist. And my response typically is, what's preventing you from doing that? So ask yourself that. Then go forward and discuss with that person. Therapy is such an intimate relationship and process that it's two people working together to help the patient, the client, challenge themselves, push back on those fears that keep you stuck in place. And you absolutely can do it. But those secrets, they're building walls. They're preventing you from getting there. And that's the opposite of what therapy is supposed to do. So what I want you to do is I want you to think about the secrets that you're hanging on to. And we got to respect them, right? We know that they're there. We acknowledge them. But then what are you afraid of happening if you told your therapist that? And sometimes it could be feelings about your therapist. If you feel like your therapist is not listening, if you feel like your therapist is always almost falling asleep, or that they seem more interested in coffee than in you, or they're talking about themselves instead of talking to you, things like that. Those can be indicators maybe you need another therapist. I don't know. I'm not making that decision. I'm just saying. But you want to explore those issues. Explore it with them. And, in my over 20 years of doing this, I've had people tell me that, what you said at this point really hurt me. And that would never be my intent. But the intent of my delivery of the message doesn't always equal that that's how it will be received. And that's true for all of us, whether you're a therapist of 20 years, 2 years, or a buddy, a friend, a lover, a brother, sister, whoever it may be. We don't control those things. That's why it's important to be open and honest and talk about those things. And I'm so glad that when my clients can do that, because it usually strengthens that relationship. They feel more open. That allows us to continue to work together, aligned together, as opposed to separate. Because if we're separate, that leaves a lot of space for that BPD, NPD, mental illness to come between us and prevent you from growing getting better and doing the things you need to do to make your life different. And you absolutely, positively can do it. And I'll see you next time.